Hi, I'm Dr. Reynolds, and I'm a GP from the Bell Surgery in Henley. I wanted to talk to you today about an issue that's been in the media a lot recently. I want to explain some reality of the situation, and most importantly, how you and I can help manage this situation. Since the COVID pandemic hit the UK, GP surgeries have had to frequently review and change the way they're doing things and managing patient care. As many of you will have experienced firsthand, GP surgeries have also made up the backbone of delivering the COVID vaccination programme, in addition to their normal work. Currently, GP surgeries around the country are dealing with a dramatic increase in patient contacts and queries. The number of patient consultations being carried out each day in some surgeries is almost double the number that was managed pre-COVID. It's no different here at the Bell Surgery, and our team are working extremely hard to ensure that every patient is looked after appropriately and everyone has fair access to the surgery. So, why is this happening? Well, there has been a lot of thought into why we are currently facing these increased pressures. Part of it is likely to be that people have been isolating and not bringing their medical problems to light until now. Another reason might be the increased anxiety levels in the population due to the COVID pandemic and the negative effect that this situation has had on everyone's mental health and well-being. A further reason is that we're getting a lot more queries from our patients that would not usually be dealt with by GP surgeries. Given the difficult circumstances, it's very understandable that many people do not know where to turn and therefore are ringing to talk to their GP.
So, what might be the negative impact of this increased pressure? Well, firstly, due to an increase in the number of people contacting the surgery, the waiting times are likely to rise. For every patient who rings up and expects to be dealt with on the day, there'll be another patient who consequently has to wait. Another real concern is the safety of our patients. What we don't want to happen is for someone with a serious medical condition or symptoms pointing towards one to have to wait whilst we deal with an overwhelming number of less serious or non-medical queries. At the Bell Surgery, we are aiming to triage, which just means to sort through, every patient who contacts the surgery to ensure that the most serious issues can be dealt with before the less serious. A third concern that we have is that a daily unmanageable workload might lead to medical mistakes or even poor staff health, both of which would then impact on the patients we're trying to look after. So, a very reasonable question is, what are we doing about it as a surgery?
Well, as mentioned just now, we believe currently that the only way to safely ensure that nothing important is missed is for the GP team to triage every call that comes in for them. We do this by first offering telephone appointments to our patients, either urgent or routine, depending on the medical importance of the situation. When you ring the surgery, our receptionists have been trained to ask you the nature of your inquiry. This is a request from the GPs, so that we can safely triage all of our incoming calls that day. Your GP is then able to decide whether a further consultation is needed, and if so, whether this is done over video or face-to-face. We have been seeing patients face-to-face since the start of the pandemic and have used this triage system to ensure that we can do this safely and effectively. We are now also using more text messaging for our patients to convey results, medication messages, or appointments. We have found that this is extremely well liked and very effective at getting information to our patients. Another relatively new system is the online e-consult option, where you can fill in a form via our website, and this then gets sent to the surgery for the doctor to read and get in touch. We developed a new and much improved website over the last year, which I'll talk about a bit more in another video. Lastly, we've been able to employ some new roles over this last year. There are many queries that are better suited to someone other than a GP to answer. We now have 3 clinical pharmacists working for the local GP surgeries who are able to help patients with medication reviews, chronic health conditions, and lots more. We also recently hired 2 social prescribers. This is a role that again I will talk a little bit more on in another video, but basically they work to link people together with other community services that might best fulfill their particular need, whether it be life-related, work-related, or otherwise.
So, the last question I really want to ask is, what can you, as patients of the surgery, do to help the situation? Well, the great news is that there are many simple things that you can do to help us achieve a safe balance for the surgery, and more importantly, you, our patients. The first is considering self-care. A lot of less serious conditions, like sore throats, coughs, and aches and pains, will often improve and resolve without the input of a GP. There are other services that can help with this, which I'll mention in a minute. There is also a wealth of self-care advice and guidance on our website and the NHS website for a wide variety of conditions. Next time, why not check these out first and give it a little time before contacting the surgery? Many conditions might benefit from the input of another specialist other than your GP. For example, if you have a muscle or joint problem, you could consider self-referring to the Oxfordshire Musculoskeletal Service, which provides free physiotherapy on the NHS. You could talk to the pharmacist next time you have a tickly cough or a medication query. We are very proud of our local pharmacists in Henley, and they can definitely offer useful advice for a wide range of conditions. I will go on to mention some other services in a follow-up video of this one. Now, the very last thing I want to request is that everyone remains kind and patient in this difficult time. We fully understand that many of our patients are going through tough times and may be anxious about their health and the countrywide situation. I can guarantee you that everyone at the Bell Surgery and all other local surgeries are working flat out to ensure your safety. Please continue to work with us, because only together will we be able to manage the rising workload. Thank you for watching.